Hi everyone. It's such a pleasure being here with you all today. And thank you so much for your time, your presence, and your cooperation. I hope we're going to have a fun class today. For all haven't known me before, I actually was an instructor in previous class. So if you are new today for the class, just briefly about myself. My name's on the screen. Sorry that I didn't follow the rule with the instructor in front of my name, but my name tells it all. It's Nguyen. So we're gonna win today. Let's win some knowledge and language skill today. Okay. So I'm currently a second year internal medicine resident in an internal medicine residency in Miami, Florida. I'm glad that I'm able to join VietMD and on the volunteers that has been generous and are willing to help us with this course. So as you all know that today our lesson gonna be about chest pain. It's one of my favorite symptoms in medicine. By the fact, it's one of the first symptoms that I encountered during my medical training. So hopefully we get through it smoothly. And I plan to dedicate this the whole class to you all so that you can practice later. So I will not speak less and save most of the time for you all to practice during the breakout room. So I'm gonna share my screen. All right. Before we start, I just want to make sure everyone hear me well and see the screen that I'm sharing. Okay. So let's just start. Okay, can everyone see my screen? You can just comment in the chat with yes or number one, that's fine to me. And during the lesson, this is gonna be just 20 minutes of my presentation. I may ask some question, very short, you can just type in, and whenever I see an answer or reply, I'm gonna call or shout out on that person who just type in the question, okay? So I'm gonna just submit, okay. So I'm gonna, so everyone sees the screen okay, right? So this is just the part one of my lessons when it's come to chest pain. So today our lesson is gonna be just focused on the history, past medical history, taking skill, and then we're gonna talk about some phrases and sentences to acquire that skill. Then we also, the next part would be, focus on obviously asking more history that help us to diagnose the chest pain. And then the next part would be just briefly some instructions for, medical profession to conduct an examination when it's come to the chief complaint of chest pain. And as usual, physical encounter, you after doing physical examination, you're gonna do some closer, just kind of summarize what you have been, what you asked the patient. Then and that we're gonna practice on that too. But the key part of the lesson today will be the breakout rooms, where you're gonna be assigned to different rooms as you made familiar by this time after the first lesson, and where you're gonna practice the script that we provided for you all. So before we started talking about chest pain, I would like to ask you all, just a small review on what you studied last class. I put it here, review on O cards. If anyone can type it quickly, what O cards stand for in the chat. And then I'll pick out anyone who has an answer to answer the next question regarding chest pain. Ready? Okay. I trying to see the answer here, but no one has typed yet. Okay. Onset, location, duration, character. Okay, we start at C. How about A? Okay, association. And R is radiation. Okay, we start at R and then T. Okay, alleviation. Radiation. Okay, severity. Perfect. Severity. Oh, so I got 106. He got everything. And severity. Okay, thank you. Thanks so much for your participation. Okay, perfect. So you all learned your lesson, huh? Okay, so we will use that old cards when to ask about chest pain. But before we start, I just like to briefly talk about, even though the topic today is chest pain, which means the pain in the chest, but oftentimes patient may come to you with different words to describe that symptom. So it's because just the symptoms is a subjective feeling that the patient tell the physician or the nurse or healthcare provider. So they may describe it as not just the pain, nothing has to do with the pain, but they may describe it as tightness, or they may just talk about some kind of very vague, uncomfortable feeling or chest discomfort, or they may describe it as some type of pressure in their chest or heaviness or tightness, or sometimes they just shortness of breath. So that all the difference. So I'm not gonna spend time to read the definitions. I believe everyone reviewed the presentation before. So just keep in mind that chest pain is a subjective symptom, subjective feeling that may or may not including the feeling of pain, but other than just discomfort or uncomfortable feeling. And then we will focus more on how to describe that chest discomfort or chest pain. So we're gonna move on. So as you all did very well on on recalling what OCARS means. So it stands for onset, location, duration, characteristic, or any alleviating or aggravating factors, radiation of the pain, timing of the pain, severity. Everyone know the abbreviation for that. But keep in mind when you apply this to your history taking section, you don't you are not necessary to be go into all of them in orders. So, but just remember that the concept of this mnemonics is like you try to get the sense of when the symptoms start or it begin, where it's located, how long has been going on, and how's the pain feel like, the patient feel like, what type of pain the patient is suffering, or what help or not help the pain gets better. Or when it comes to location, you can just connect to the radiation itself. So I put up here some verb so that you guys can kind of think about how to ask about the onset of the pain, or how to ask the location of the pain, because when we talk about onset, you think about timeline. So the keyword or the questioning words would be when. So when you use the when, you have to use, as we all learn in English lesson when it was in elementary school, it have to do with the questioning word, and then comes some kind of connecting between verb and then objects, things like that. So just trying to practice yourself with the when, where, how long, and then the verb that I provided, so that you can form a questions. So let's start with the first one. So as I mentioned, when is referring to the timeline of the symptom, or in this case would be chest pain. And I listed here quite a lot of different questions. It's the same purpose of asking, how did it start, or the onset of the symptoms. So what the purpose of this kind of question is, you want to know if the chest pain started, suddenly, gradually, or it's not been a new issue, or it's just patient has been have this, for a while, and now it's become more worse. So keep in mind that you don't have to learn by heart all of these questions, but make yourself comfortable with any questions that you feel like you can speak is smoothly, quickly, and you can recall quickly when you ask the patient. So you will have more time to practice the question with the teaching assistant or our volunteers later on. So when it's come to where, so where is mean location. Patient may refer to different, places where they feel pain. Even though here I mentioned it chest pain, but the chest pain that we actually concern, obviously it have to come, it have to do with some cardiovascular etiologies. We were talking about several locations where the patient usually refer to their pain. But in order to get that information, you have to ask the question right? So this very simple question that you can all start will be, can you point where your pain located? So the key in history taking, as you may know in the first lesson with Dr. Nguyen, is we try to encourage to use open-ended questions. However, in real life, sometimes you encounter with different patients in different scenarios, depends on how much time you have to get the information from the patient. So you can always start with an open-ended question so that the patient can provide you with what they feel as much as they can. However, you can kind of give them some guidance so that you want to get the specific information that you may help you to characterize the chest pain. All right. So as you see, most of the other questions that I listed here, it start with yes, no question, like does or is. Just try to kind of like you want to kind of confirm was the location of the pain where you actually concerning, or it give you more information to diagnose the chest pain. Let's say on the right side will be the images that listed as a possible location for chest pain. Patient may use different words, but when you document it, you can use these words to report it or describe the pain about its location. So let's say upper chest pain, substernal, or it can be sometimes it's just like neck, jaw pain, epigastric discomfort, or epigastric burning sensation, or they can just come to you with some kind of chest pain accompanied with shoulder pain or back pain. That is about location. The next one is we want to ask about duration. So duration is mean the period of time, and obviously the word to ask that would be how long. So you can ask directly, how long is the pain going on, or you can ask that, there's here are three questions that you can use, but obviously you can rephrase it differently so that it can work well for you and it's easy to remember. Let's say I usually ask how long has the pain bothering you, or how long is it going on. It's just very just work well for me. So just stick with one question and use it. Okay, so next one is when we talk about pain, the key to characterize it is the keys to help us to diagnose what type of chest pain is. Then the question regarding the characteristic of the chest pain is very important. So the patient may describe it differently. They may word it differently, but here I listed on the right side is a different type of pain. But like I mentioned before, that is always a good or helpful tip to ask the patient with an open-ended questions. The most straightforward one would be, can you describe the pain for me? And they started tell you, how they feel. They may so the second box here is some adjectives that to describe the pain or the chest pain. They usually tell you like burning, sharpening, or pressure. I just want to point out the reproducible here actually is not something patient reported to you, but you can use it after you examine the patient. And what exactly mean, I can explain it later during the physical examination. But again, patient can use different word for pain. I listed here, they can use the verb, I feel my chest hurts, or my shoulder hurts, or I feel ache in my chest. That's something that you can get familiarized with when the patient reports that symptom to you. If patient cannot, sometimes they just in pain, they feel uncomfortable, so they're not gonna give you all the characteristic of the pain at a time when you ask the patient. So it's always good when to being active with your listening, take some notes, and have some pause to kind of like further clarifying the information the patient just provided to you. Or if you feel like you need to know more about that kind of pain that the patient's suffering, then you can ask the patient, can you tell me more about what you feel? And then you can kind of like give them some cues about how they feel, so that they can kind of relate to what they felt at that time, exactly at that time. The last box is about, it can be used during to describe after you get the information for the duration. So let's say the patient said that, the chest pain had been going on for days. Then you can ask more, if the patient have that every day, throughout the day, it's different than, it just comes and goes away, then you can describe it as an intermittent pain, or something like that. So the last box is more to describe the duration and the progress of the pain. We can move on to the A in the O cards, is about alleviating and aggravating factors, or I put it just in the simple words here, better or worse, or which means, if there's anything that make the chest pain worse, or what make it better, but it can use to ask about, what brings the pain in. It kind of ask about the triggers of that symptom, because it's so important to know what kind of pain, what kind of factors are associated to the chest pain, so that you can characterize it and further do the investigation to diagnose the etiologies of the chest pain. So here's also again some very common question that you can use to ask the patient regarding the alleviating and aggravating factors. I didn't list it here, but it very often that I actually listed here. So often here in Vietnam or in America, patients usually they try something before they actually go to see a doctor, because in order to see a doctor, it takes a lot of time to make an appointment. That sometimes they have to wait after such a long time. So they try something before to help with the pain before they actually go into the emergency or actually reach the medical attention. So you can ask, like what kind of medications. When they talk about their medication, it's always good to get the list of medication and how often, how much they have to use to relieve their chest pain. later on in the next section that I can mention more about medications. But for now, we just try to focus on how to ask what makes the pain better or worse. Then the R's in the O cards, irradiation. So just try to recall what we used to ask about the radiation, because in chest pain, especially one of the most concerning etiology of chest pain is an acute heart, MI, or a myocardial infarction or heart attack. The radiations of the pain can give you a lot of information to help you kind of leaning towards to if it's, if the chest pain is more likely due to cardiac etiology or different type or non-cardiac chest pain. So you can ask by just simply ask, remember that the verbs that I listed at the beginning, to ask about radiation, we can use the verb move or goes. So does the pen seem to be moving or radiating anywhere, or does it go anywhere? And then the patient can point it to you. And on the right side is the picture that you can, illustrate some uncommon radiation of the chest pain. It can go to the right arm, or the patient may feel some pain in the jaw, or they can feel the pain in the epigastric area. So another verb that you can use to ask about radiate here is the word spread. But again, you can learn all the as many verbs that you can, but use the one that you feel most comfortable speaking with. Okay. So, like I mentioned before, the most important part of the chest pain history is the characteristic of the pain, the chest pain. The chest pain can come with other symptoms, especially some very concerning symptoms that that kind of make the patient feel very uncomfortable, and they feel very worried about the pain that they have, and usually will rush them to the hospital. On the left side here is one of the is listed as those symptoms. For example, if the patient feels chest pain, but they also feel choking at the same time, by that mean the patient may came to you and they told you that, they didn't mention about chest pain at all, but they said, I feel choking in my throat. But then if you asked more, they will, did it come with any symptoms before that? Or did you feel anything else beside the choking? And then they started telling you more about their chest pain. So keep in mind these symptoms on the left side can be an associated symptom with chest pain, but it is also presenting symptoms of chest pain. Okay, so like cold sweat or shortness of breath, patient may have severe or intractable nausea or vomiting, or sometimes they come to you and they just complain of numbness in their hand and arm. But then again, if you take a better history, and they will tell you about the chest pain that comes before their numbness and discomfort in their hands. I think the most concerning here is right now most of the patients not most, but majority of patients here, they wear some kind of iWatch, some wearable device, and they kind of they notice their heart rate, the frequency of their heart rate, and then when they experience the chest pain, they may notice some change in their heart rate, and that become more concerned when it comes too fast or it's become irregular, and then they started worry and then go into the hospital. But with this kind of irregular and fast heart rate, what they feel maybe is the symptom of palpitations that I did not list it here, but that can be one of the symptoms that come with chest pain, and also very concerning, and is more suggestive of cardiac etiology of chest pain. So that is about the chest pain. So bottom line is chest pain is just like any kind of pain the patient comes to the hospital with you. Of course, it is a very helpful tool so that you can better, take in the history of the symptoms, characterizing it, and help you to kind of like working on your working diagnosis and differential diagnosis, and come up with the appropriate testing. Okay, so but in order to come up with a diagnosis, obviously another important part beside the presenting symptoms is other histories, and we all know that other parts of history in your HNP is medical history, surgical history, family history, or social history. The very important medical history when you ask a patient who comes with chest pain would be the history of any coronary artery disease. Their personal history or their family history also very important too. If anyone in their family have history of CADC, it's important to ask at what age that family member was diagnosed or died from that disease, because there's some condition that we attribute it to inheritary, then it's usually happen in early age, and rather than it come, if a patient who a family member who gets that disease very late age, or maybe not so much of a familial history there. So but it's always good to ask at what age that family member had that disease or condition. Okay, and other medical histories that important and that can relate it to the chest pain history is diabetes, hypertension, or any lung disease. Those diseases is associated with a cardiovascular disease that may attribute it to the chest pain. Sorry. The next one is also important too, is social history, that when you ask about smoking, alcohol use, or drug use, or their lifestyle, you guys are gonna have more time to practice on these kind of questions. But keep in mind what we need to ask. It's always good to have specific questions, and so that you get a specific answer. Let's say, I usually ask the patient that you smoke, but I forgot, I forget that there's different type of things that they can smoke. Sometimes they just, they smoke, but they actually can smoke cigars, different from tobacco or marijuana. So be more specific about your questions. And also, when it comes to alcohol intake or tobacco smoking, ask how many cigarettes or how many packs they smoke, for how long. That's also very helpful with the diagnosis too. So after that's enough for all of the questions, then you're gonna kind of like stop there, and then the next part of your encounter would be doing some physical examination. I don't know how much of the participants here are actually involved in physical examination, examining the patients. But this is very general instruction that you can use to instruct the patient during the physical examination section. Here, this is something that I learned when I entered the residency and become a trainee in the US. That before you do anything is you have to explain to the patient, because they expecting it also so that they can clear about what happened next. Explain to them what you're going to do, and you also need to familiar with the questions or some phrases or some sentences to ask them to reposition or do some maneuver so that you can conduct your physical examination. So on the left side is very there's some bullet points that in the OSCE exam that you can use if you encounter a patient with chest pain. Is that's something you don't want to miss during your physical examination section. So obviously before you examine the patient, you wash your hands, and it's always encouraged to kind of like gown the patient or drop in the patient respectfully, and then you started examine the patient from head to toe. On the right side, I listed here some very common questions or phrases or sentences that you can use during your examination with a patient who coming with chest pain, but it can be used in any scenario that you want to conduct a physical examination to the patient. Let's say, for example, you said the patient, can you lie down or sit up for me? Or you want to ask them, take a deep breath in and out for me, but we always keep in mind that be polite to the patient, obviously, to make them feel comfortable and be opening to our examination. And then here, there's a sentence that I listed here that related to one of the characteristics of the chest pain that I mentioned earlier, that reproducible. So in order to have that kind of description to your chest pain, you will do something that we call is like an examination on the patient. You said that I'm going to feel your chest and rib cage for any tenderness and or swelling, or do you feel pain when I palpate you or when I push it here? Then if the patient feel pain there, it means that the patient only feel pain when we touch or deeply palpate the patient. So that pain is reproducible. It means we produce that pain. But outside of that, the physical examination, the patient didn't feel pain at all. Then we can describe it differently. Or that's the last sentence that I put it here, like, we're going to press on different parts of your chest. And so let me know if it's tender or painful. That's the phrase that I usually use to examine a patient with chest pain. And obviously, after your physical examination, you want to do these 4 things. It's not always you don't have to include all of the 4, but it is encouraged to go through these orders to make sure the encounter address all the concerns and give you, the courtesies of the physical encounter to the patient. Okay, so the first thing you want to summarize all the information that you got from the patient, so that you don't want to miss anything, and also reassure, reconfirm that the information that the patient provided to you, so you can start with some sentences like, to summarize what you just told me. Just want to make sure that I don't get anything wrong. Or you can use different phrases like that. The instructor during the break rooms can suggest or give you more information to practice on the summarize. Then the next step, you can ask the patient for any concerns, any thoughts on their symptoms, so that you and what they can expect from our assessment. And then last but not least, you're gonna thank the patient for their time, their cooperation. And also after that, you actually can close your encounter, and then take off your gloves, your gown, or wash your hands again, and then leave the room before you can come back to explain anything else or offer any further information. So I know that's a lot of speaking, but that's briefly introduction to chest pain, how to get a good history of the present units when it's come to chest pain, and what happened next after you the history part would be the physical. What we call here is history and physical. So we can usually break the encounter in two parts. Like that. So that's it for my presentations. I hope I make it within 20 minutes, and I'm open up to any questions. For now, before we move to the break rooms, let me just open.
Hello, Nguyen. Just
yes.
Stop sharing.
Okay, gonna stop sharing.
Yeah.
Okay, thank you. Okay.
I think there were some questions in the chat, but it was answered by crowdsourcing.
Oh, okay. That's very helpful. I know that, so like I mentioned, the first section is very brief and I may speak so fast, and I promise next time. It's hard to, you know, when I don't see on the faces, so I don't know if anyone's facial expression to see if any like questioning, not getting lost in there. So I hope that if any, I will be observing each breakout rooms, and give you feedback during the practice section and available for all other questions. All right,
so
I leave.
I'm gonna share the break. So we've pre-assigned the learners, the Vietnamese learners, into breakout rooms. But in the event that you go to the wrong room, I just wanted to put this up. For the observers, then there will be a room 11. So you'll be assigned there. For our facilitators, Nancy, I reassigned you to room 10, okay? Because we had some absences today. So, okay, I'm gonna stop sharing just to make sure everyone sees the screen. I'm gonna stop sharing and then, all right. Fingers crossed. Let's hope this works. I'll open up the rooms.
And then you need to do the survey, the poll right now.
Oh, yes.
Sorry.
Yes. Okay, now I just pop up very quick one.